Assalamu alaikum. This is the anterior part of the pons and the medulla, mainly the medulla. The upper region is the pons while the lower region is the medulla. The pons and the medulla are separated by a junction that is called the pontomedullary junction, below which lies the medulla. Medially lies the pyramid swellings, pyramidal swellings of the pyramids due to the pyramidal tract, or more specifically the corticospinal tract, that is the motor tract, and laterally the olives indicated by the O. This is the pons upwards, below which lies, this is a pontomedullary junction, below which lies, this is the medulla. The medulla, this is median fissure that is called the anterior median fissure, lateral to which lies, this one is the anterolateral sulcus, lateral to anterolateral sulcus is the posterolateral sulcus. In between the anterior median fissure and the anterolateral sulcus lies the swelling is the pyramidal swellings due to the pyramids or to the pyramidal tract. Lateral to the anterolateral sulcus, yani in between the anterolateral sulcus and the posterolateral sulcus is the olives. Olives की वजह से swelling है, more specifically due to the inferior olivary nuclei. Then lateral to this is extending the inferior cerebellar peduncle. The cerebellum is connected to the midbrain through three peduncles. Cerebellum is connected with the above midbrain through superior cerebellar peduncle, with the pons through middle cerebellar peduncle, and with the medulla oblongata through this inferior cerebellar peduncle. The foramen here, which you can see at the cranial most part of the anterior median fissure, this foramen that is present at the cranial most part of the anterior median fissure at the junction of the anterior median fissure with the pontomedullary junction, this foramen is called foramen cecum. Foramen cecum. This is a foramen cecum, an important MCQ point. And then we see the blue fibers. These blue fibers are basically on the anterior side, and these indicate the anterior external arcuate fibers. You must differentiate between the external arcuate fibers. There are two types of arcuate fibers: external arcuate fibers and the internal arcuate fibers. This is the anterior external arcuate fibers, और उसके नीचे से ये फिर ये कम्युनिकेट कर रहे होते हैं बेसिकली सेरिब्रम को विद द सेरिबेलम. सेरिब्रम से फाइबर्स आते हैं इस एक्सटर्नल आर्क्यूएट फाइबर्स के अंदर. आर्क्यूएट न्यूक्लियस होता है यहाँ पर, फिर जाते हैं इंफीरियर सेरिबेलर पेडंकल और फिर सेरिबेलम के थ्रू ही कम्युनिकेट करेंगे. यानी ये दिस इज़ अ आर्क्यूएट फाइबर्स यहाँ पर होंगे, फिर ये इंफीरियर सेरिबेलर पेडंकल से सेरिबेलम के थ्रू कम्युनिकेट करेंगे. देन यू कैन सी दीज रेड indicated by the red marker are the decussation or the crossing overs of the motor tract. That is basically shown the decussation crossing of the anterior corticospinal tract. The corticospinal tract in this 80% fibers decussate to form the lateral corticospinal tract, and the 20% remain on the anterior side forming the anterior corticospinal tract. So the lateral corticospinal tract and the anterior corticospinal tract, these decussation of the motor tract. This is basically the motor tracts, and this is basically the pyramidal tract running in the pyramids. Then now we talk about the nuclei of the cranial nerves. So सबसे सामने आपके medially lies the 12th cranial nerve का nucleus, that is the hypoglossal nerve. That is an important MCQ point, that it lies at the anterolateral sulcus. Then medially on anterior region, in the pontomedullary junction, there lies 6th cranial nerve, that is the abducens nerve. As you know, 12th cranial nerve is the hypoglossal nerve, the 6th cranial nerve is the abducens nerve. Then lateral to the abducens nerve, we move to the superior to the olive. This is the facial nerve. Now the facial nerve we know is a mixed cranial nerve which has a motor component and a sensory component. So this is an important MCQ point, that the facial nerve, 7th cranial nerve, motor component lies medially while the sensory component lies laterally. Or in the MCQ it could be asked, the motor component lies more close to the anterior median fissure while the sensory component lies more close to the posterolateral sulcus. This is the posterolateral sulcus, this is the anterolateral sulcus, and this is the anterior median fissure. These are labeled here: anterior median fissure, anterolateral sulcus, and the posterolateral sulcus. So the motor will be near the anterior median fissure. Remember, M for motor and M for the median. So medially, median के करीब होगा, median fissure के करीब medial nucleus of the 7th cranial nerve, that is the facial nerve. Then lateral to this lies the 8th cranial nerve nucleus, that is the vestibulocochlear nerve. So हमने कौन सी cranial nerves देख ली? 12th cranial nerve, that is hypoglossal nerve, 7th cranial nerve, that is a abducens nerve, then the 7th cranial nerve, the facial nerve is a motor component, sensory component, then the 8th cranial nerve. 8th cranial nerve is purely sensory, 7th cranial nerve is a mixed nerve having a motor component and the sensory component. Then on posterolateral sulcus के posteriorly जो ये आ रही होती हैं 3 cranial nerves, the 9th cranial nerve, the 10th cranial nerve and the 11th cranial nerve, glossopharyngeal nerve, vagus nerve and the accessory spinal nerve. इसकी दो रूट्स होती हैं, cranial root और spinal root.